So I'm just picking back up with our Unlimited Palfrey Award winners, looking at how you find data to beef up your funding bids, pitches, crowdfund campaigns, or pitching to commissioners. Once you've been running a little while, or even if you haven't, the more quality information you've got that can show the real demand for what you're doing, the better. There's two ways you go about getting that information. One is using existing information, which I'm going to quickly look at with people. Everybody's story, venture, mission, vision, reasons for doing what they're doing. Every community is different. So you'll all need to research and look at different places. But on this slide, it gives you in a nutshell where you find this stuff. So I'm going to show the slide. I'm going to go online to just show you where some of this stuff lives. So you don't feel like, oh, I can't go and find that. And you guys might have your own intelligence or your own places that you go for research that we could just shout out and have a look at if people have got other tips and ideas on this stuff. And you don't have to, you'd have to be an academic, you don't have to be a special researcher, you don't have to have a degree to do any of this stuff. It's just information that's sitting there. I will say some of it is hard going. I think I don't read anymore because I just tend to read policy reports and bits and pieces, but some of it's such, but the thing is, just as you can be frightened about finances and putting financial figures together, once you realize that there are patterns and shapes to all of this stuff, or that, if you learn how to do it, it then gives you a way to make profits to invest in what you want to do. You've got to kind of flip your brain into finding the why bother, how to make it interesting for yourself. Same goes for this sort of stuff. Although some of these documents that you might find, are like super lengthy, 30, 60, 100-page reports on there's always an executive summary. There's usually, there might be an infographic if that suits you better. And the thing is that this information is often so important and so useful to you that it's worth finding it and it's worth bothering and persevering with. And often these reports they've been put together by really interesting people, or people who have got more knowledge on all of these topics, and you can follow up with them and have a conversation with them sometimes, depending on how old the reports on that sort of stuff. So it's a way of finding the way that suits you best to kind of try and get into doing this and find this information. So on this slide, just briefly, I've tried to categorize it, and it's not a very good slide. On this left-hand side, this is kind of more national government stuff. So the NHS, the Department for Education, I can't remember what BIS stands for now, but it's basically, business and the economy and trade and industry, and the Department for Work and Pensions. Every government department has reports that they produce till the cows come home. Rightly or wrongly, an awful lot of money gets spent on this stuff, going around in circles, consulting, and whether that turns into the recommendations ever turn into direct action is another. But it's all sitting there. They've all scrutinised this stuff to death, and they've all said what they should do and what would make life better. And social enterprises or innovators and leaders often come up with really good solutions to tackle and address these recommendations, but they also come up with more, not always, but often cost-effective ways. That doesn't mean cheaper necessarily. Your services might be a bit more expensive than somewhere else, because you're doing it in a much more labour-intensive way, or you're working with supposedly harder to reach groups, or you're creating a surplus in order to reinvest that money back in doing more good. So I'm not going to say, social enterprises are cheaper when I say cost effective, but they get far more bang for their buck buying from you if they know about you. And if you can articulately tell them how you're going to address their policy priorities, or how you're going to address these oodles of recommendations that some boffin somewhere got paid to come up with that nobody's implemented, and that kind of thing. So basically, some of the policy reports that are relevant for you guys are things like, there's this Futures in Mind that was produced by NHS England. It's around health and wellbeing. There's a 5-year, it's a bit old now, the 5-year forward review for mental health. And what is this? Oh yeah, building the, so there's an awful lot of information around health and well-being sitting there, amongst other things. And I'll go and quickly flick on to a couple of those in a minute. There is a new thing now, past the 5-year forward review, that I pulled up because that's a bit old. You have to keep sort of looking at what's new, but it's all there for the taking through Google. You know, it's, some of it's a bit fiddly to find, but not really. Here I've got the GMCA, but in your case, it would be West Midlands Combined Authority. I've got to say, it looks like West Midlands Combined Authority are updating their website. There's this beta version thing I'll show you in a minute. Manchester's is far better to read at the moment, and there's loads of access to policy reports that I know how to find. I find it a bit harder to navigate, but we'll pop in and have a look at that. In the middle here, what have I got? They're not really grouped, but Joint Needs Strategic Assessment, Strategic Assessment, I think it's called, JNSA. I've found the one for where you guys are, so we can look at that. ONS, Office of National Statistics. Some of you will have heard of Mintel reports that you can get online, or then you have to pay for. They're like market intelligence reports. It's tried and tested, they've gone on for years. Like Gallup polls and things like that, people might have heard of, and that sort of data. You can access them for free, usually at your local libraries. They're often paper-based and they might be online, but they're very good for all sorts of market intelligence, particularly if you're working in a particular recognised sector, like, I don't know, retail or certain product sales, or there's loads of them. You best to have a look. health and wellbeing education, that there'll be Mintel reports on. And then down at the bottom here, I've got CLES, IPPR, SC UK. So these, that's the Centre for Local Economic Strategy. IPPR, God, what does that stand for? Anyway, they're like a think tank, Institute of Public something. Sorry, I've not come on with my knowledge. They're good though. They produce really good reports, and they're nosy, and they're trying to tackle, you know, like Nesta, you know, are going out to innovate and look to uncover where inequalities lie, like the Joseph Rowntree Joseph Rowntree Foundation, Esme Fairbairn. These Mind are another, you know, national agencies that have either a research and policy arm or a think tank attached to what they're doing. SC UK has all sorts of statistics around the social enterprise world, as do SC Mark to a point, but SC UK is the kind of recognised kind of body of for promoting and representing social enterprise in the UK. So that's a quick, where might you find this stuff? I'm just going to stop sharing in order, or where are some examples? Does anybody want to shout anything else out that they think is relevant to this conversation, or what, you know, reports they've found that have been helpful, that taught them information or stats that they didn't know existed? You've all gone quiet.
We've used Big Local Insight, which helps, and you can get a lot of information from that, tailor-made to the Big Local areas.
Say that again, sorry. Big Local website, was that?
Insight is called Big Local Insight. Yep. So they use it from national statistics, but make it tailor-made to our area.
Cool. That sounds good. Mark's got his hand up there, I think. Fire away.
Yeah, public health annual reports and special papers on various things. They'll it might be focused on any particular area, say mental health, but it'll also have data there that covers other age groups and other issue areas.
Absolutely. And yeah, they're often, it varies. Sometimes they're written in quite layman's terms, sometimes they're really hefty, but I was just going to flick through a few things. It's a lot to think about on a Saturday when we should really be winding down, but to read at your leisure some other time. This I pulled up, and likewise, Emma, for you, I can show you where this exists in the Northwest. It'll be like Manchester or Stockport. I think they're probably done on a borough-wide area. We can check, but anyway, Walsall Insight here talks about your joint strategic needs assessment, and in here it talks about what it is and blah blah blah, and basically you can go in. And I pulled this out because joint strategic needs, it kind of combines, as it says here, there's a whole bunch of stuff around health and well-being. There's a whole bunch of stuff around at the place itself, and strategic needs around crime and social justice. And so it's a kind of combination of factors that they look at. And basically, I just download the report rather than do it how I'm showing you, but I don't know if that's even going to work. Basically, in there, it will give you lots of stats. So when you're trying to apply for funding, to give people a sense that A, you know what you're talking about, and B, there's whatever it is, deprivation, health inequalities, you know, issues around social justice or whatever else. It will, you know, things to do with young people. It'll tell you what the priorities are and what's going on. If that makes sense. So you'll recognise what this is saying, because you'll know the names of these areas. Forgive me, you know, but it's telling you what's going on with the population. So in terms of, you know, aging population, you can clearly see, just looking down here, you know, projections for certain boroughs, and it's telling you, you know, the number of 60 to 79-year-olds here and the increase there. And, you know, clearly, you know, there's lots of information in there for most of you that are tackling health and wellbeing inequality. So just throw that one to look at. So sometimes you might be applying to a local funder, or if your project's very localized and you're not fully up to speed with exactly what's going on in that area, or maybe you're replicating your project in a new area further down the line and you don't really know heaps about the place. They've just got a nice juicy pot of money that you want to go for. I don't know, I'm being mean there, but you know, whatever the reason is, there's different ways you might want to come and do this. Office for National Statistics is the place to go. And basically, to find, there's loads of statistics that they have on this site, by the way. It's not just, you know, there's business and trade, there's economy, employment and labour market, people, population, education, childcare, blah, blah, blah. It's all there. Lots of people constantly updating stuff. Some of it's based on the census, some of it's not. Some of it's based on other sort of business surveys and things that get done. But anyway, you go to the local statistics, you click on this NOMIS, as it says, it offers free detailed reports on stuff. Has anybody ever used this before?
No.
It's free, it's sitting there. There's nothing stopping you. Your competitors might be using this. So I'm just saying, you can get loads of information out of this, and it hurts your eyes at first, but once it starts churning out these reports that start telling you all of this juicy information that you need, it's really helpful. I haven't got time to go in and thingy and look at one, but you could put in the postcode and it would churn up, you know, basically a data breakdown for your population ages, who's in work and who's not, percentage of people on certain kinds of benefits, all sorts, everything that would be relevant for a lot of what you're needing. Households that are of certain types, all sorts of stuff. So it's worth knowing that that exists, because you might find that that's useful. I pulled up Mind only because I know Ebony had got on the, oh, Deb's raised a hand, or Mark has, far away.
I always say this just a quickie, and I'm never sure that it is. A lot of what we're doing is clicking on data. It's a screen, it's a mouse. How much, with the successful bids experience that you've got, how much of it relates to clicking on a person or clicking on to people? Does it help? Does it help if you're already in a network locally, your local church group, Neighbourhood Watch, your WhatsApp group, although that's a bit clicky on whatever?
Yeah, I mean, you're making a good point there.
Can you see your MP? Can you go and see Bambi Burnham, you know,
technically,
as the King of the North?
Yeah, no, they're all really good points, aren't they? And I'm sure you know the answer to your own question there from many angles, but it's a good question to ask for the wider group, in the sense that it's always good to be part of wider groups, show that you're connected. It's for you know, partly to show that you're connected, and partly to be genuinely connected, partly to build trust and respect and allies, and actually to work out who you're never going to be able to work with. But it also, being around your peers, whatever way, shape or form they are, they might be more in the know than you are. And people are relatively generous in what they'll share. You know, there are some people who are highly competitive and won't share a thing, but the more you can be around physical people through forums, face-to-face, specific meetings, ways of getting in touch with, like you say, getting in touch with your local councillors and MPs. It depends what you're doing and whether or not you need that, and whether or not you want that, you know, and whether or not your local MP gets what you're trying to do. Or they might agree with it, but they might be lobbying for something completely the opposite. It's a difficult one, but certainly it's the age-old phrase, it's not what you know, it's who you know. Some of these funders, big funders, quick turnaround funders, they don't want to see you, they don't want a phone call, they're never going to meet you, they're just ticking boxes, seeing if, you know, and it might not meet, sometimes when they're not running such a quick turnaround fund, they might have the time for you, but currently it's rare that funders want to see or meet or have too much involvement with people, which, you know, is a blessing and a curse in both ways. Other funders like Lankelly Chase, like I would say the larger the amount of money you're going for, the more likely is they're going to want to talk to you. So if you're going for 500 to 10 or 15,000 pounds, there's a good chance it's fill it in, hope for the best. If you can ring them, the more that you can get under their feet and get them to know who you are, or the, you know, that you're on their radar, absolutely. But until you're getting over a certain amount of money as well, some of them will be less inclined to make that physical contact. Depending on the money you're going for or the partnership approaches that you may or may not be entering into, absolutely, you've got to be known and you've got to be in with certain people. So,
Nicola, if you did happen to live next door to Marcus Rashford, is it useful?
I really do. He's building a place up the road here. I only found that out the other week.
Is it useful to name sponsors? Does that help, or have you got to be very careful with that?
I think for funders, funders love to be associated with all sorts, don't they? So I think if you've got people on your board, I think name dropping in funding bids of partnerships you've got, endorsements you've got, you know, those sorts of things, you know, usually for a funder, or, you know, and public sector contracts are helpful. I would say so.
Okay, thanks.
Yeah, I mean, again, there's always the flip side, isn't it? You know, there might be a Man City fan, the person reading the form. So, you know, I'm being
I can't believe that, Nicola, no.
that there's there might be the case. There might be the cases where, you know, you've given them all this information and they've made a judgment on you and your organisation on the basis of who you've got involved, or you might look so successful that what on earth do they need our money for? So, you know, there's that kind of caveat, but you know, in the main, it's helpful to show that you've been recognised and that you're involving various sorts of people and you've got certain kinds of backing. So that would be my thoughts on that. I'm seeing time's rolling away with us, and I definitely want to get onto a quick intro around social value. So I'm just showing you that lots of national agencies have their own research and evaluation departments, mine being one of them, and they will have already done oodles of research into, so whether it's Mind, whether it's veterans charities, whether it's young people's charities, whether it's you know, Beat that deal with you know, bulimia and eating disorders, whatever your thing is, there's big charities up top that have been doing it for years and have all the data already gathered, and they'll often churn it out in their marketing, in their annual reports, in their wider research documents. So go steal it. It's sitting there, out there. It's public information. What was this? Oh, this was me just showing you that what's happened next. So the 5-year forward review that's there is still useful information because there was an awful lot of work done around that, but it's now, some of it's turned into this NHS mental health implementation plan. So this is taking us to 2024. That's the only reason why I pull this out, is if you're working in health and wellbeing or mental health, you know, is relevant to your world. Section 2, implementation for therapeutic acute, older people's mental health, blah, blah, blah. You need to be reading those sections just to see what's being said at a national level. And there might be some really juicy sound bites in there for you. I don't know, I've not checked. Arfan, you've got your hand up.
Yeah, has anything changed with that document? Has anything changed in that document in terms of COVID? Anything changed in terms of COVID for that document?
In terms of COVID, I don't know if it's changed in terms of COVID. I know this document, you know, it's an I kind of just Googled it this morning because I knew things had moved on and I thought, what's happening now? So this was produced in 2019. So that was kind of slightly wasn't it? Slightly pre-pandemic. So I don't think they'll have caught up with themselves yet to have changed. They're probably in the throes of doing what you've just said there. It should have done, shouldn't it? So you can only go off the data that you can find in these cases. And as you rightly pointed out there, you can be damn sure there's a hell of a lot of people getting paid an awful lot of money to update this to a 2021 version, if there isn't one already. I've just pulled what I found off the internet most recently, so there might be a more up-to-date and accurate version. I don't think there is, otherwise it'd have been sitting up top in the list. But we're due one, aren't we, looking at the dates of that? Whether or not they've built the capacity and the budgets to produce the next set, I don't know. But let's, it's certainly something to, if there's not a new document out by the spring, I'd be very surprised, because there needs to be. So, but it's just showing these documents are there, they're sitting there. Go and have a good rummage and see what you can find. I'm happily, if you're not doing it yourself, I'll happily put that in the chat.
59.
Let me just mute you. I don't know. So just quickly, I am going to put that in the chat as an example, and I would just say sort of Google at your leisure. I'm happy to chat to people on an individual basis on this stuff to just navigate what might be best for you to find. So we've got 5 minutes, which isn't long enough. What I'm going to do is pull this open. I just think that's like a little bit of gold. That's the bit that people don't think about, or they don't know exists, or they're wondering why they're not getting these things. And some of it's because of that, not knowing where to go to find the stuff. So I hope that's been a little bit helpful, and you can rummage around at some of this stuff when you're ready. When you first start out, you've just got to talk to your community and give things a go. But certainly within 6 to 12 months, 12 to 18 months, and certainly within 2 to 3 years, all of this stuff starts to get a lot more relevant because you're going for larger bids, contracts, commissions, or whatever else. So there is a slide in there, what to do when you get rejected. So you can have a read of that. And I think we've gone through most of this stuff. What I was going to jump around to just very quickly, because I want to run another session, and Ebony's going to be killing me because I think she came for this and we're spending the last 5 minutes on it, but there's so much that you can talk about on these things. And I've got a listen again webinar on this, so all is not lost. So social value, who cares, what is it, why bother? Basically, social value really is, in part, it's ties in very closely with this term theory of change. What's happened is people are wanting to know the so what, when money is tight and the social value acts come in, and there are various reasons as to why social value and impact measurement needs to go beyond just mapping the basics. And so I'm just checking that I've not missed anything. Oh, that's all right. Oh, good. She's not falling out with me. Basically, there are some simple ways to look at this, and I can come back and, as I say, do a bit more detailed version of this. But there were some tools I wanted to at least walk you through these tools, because they're not difficult, and you could go away over the next few weeks and have a go at these. You can read the slides around, what is this stuff? Basically, the term social accounting is all about how you measure the change across a stakeholder's journey. What is a stakeholder? Basically, anyone and everybody who's got a vested interest in what you're doing. They might be customers, they might be beneficiaries, they might be wider interested parties. You've got local, regional, national stakeholders. You've got direct stakeholders, who are the people who are directly benefiting from your services or what you intend to do. And then you've got wider stakeholders that might include the families of, or local businesses, or the wider world, like even local authorities or education departments, or the environment agency. Whatever it is that you're doing ties into a whole food chain of sort of people that have got a vested interest in the fact that you exist. Whether they've ever met you or not is another matter. So what social accounting is trying to do is map the ripple effect of the impact of what you're doing, so that you can better communicate it with people. And there's different levels of doing this. So There's doing it in very basic ways to make it work for you on a simple level to improve your marketing, or to report simply back to your funders. And then there's doing it on a much more thorough level, where particularly if you're going for, let's say, social investment, or if you're going for commission contracts, or if you're in a crowded market and you've really got to stand out as to kind of why you need backing or commissioning, putting financial values on how you're saving the public purse is basically what this stuff is. And there are simple ways of doing that, believe it or not, more simple than people would think. I won't go through the whys. I'm sort of suggesting that earlier. There's various reasons as to why this has become more interesting for people and more relevant. But to be fair, it's always been necessary if you want to do a good job and sleep at night knowing that you're actually making a difference. If you want to be able to communicate with a broad range of people and improve your marketing, improve your services, and certainly if you want to strengthen your bids case and access to wider backing and endorsement and investment, doing this stuff really does help you in the long run, and putting simple things in place to get started, so it doesn't overwhelm you. So that what happens is, if you don't look at this for 12 to 18 months, you've had loads of amazing impact happen and it never got captured, or never properly got measured, or you've nothing to benchmark on. So even if you just did a few simple things to benchmark where you're at now, you can start to show what the journey traveled looks like for both your organisation and its impacts, and the individuals and wider communities that you're working with. So I was going to show you. Oh, go for it, Mark.
Yeah, just quickly. I presume you can do bog standard things like keep a diary. You've got
Absolutely.
your own personal diary.
I'm going to come on. I will share that slide with you in a second. How do you do it? So I'm just covering some tools. Sorry. And what I'll do is I'll share the webinar, which is a good 40 minutes in itself of all of this stuff. But I'm just going to whistle through. One of the best places to start, rather than jumping initially, is it's hard to measure your impact if you've not worked out what it is you're doing yet. And so this little tool here that you've got in your pack that I sent you, and you'll get these slides anyway, is working out what is your theory of change. It's like, what the hell does that mean? People ask you that. It's very hard to put on the spot. But if you can answer these questions and fill in these boxes, eventually it might take you 6 weeks, it might take you 6 months, it might take you 2 years, but you'll get to a point where you can do this. And so what happens is you start to be able to describe what you're doing for yourself. All of these tools sort of tie in together. There's a business model canvas, or there's this theory of change. And I'm just showing you some models here. I find this a good place to start, because you can start to say, and rather than me show you a blank one where you think, ugh, what does that mean? And let me show you one that's been filled in. And it'll prompt you to come up with your own. So what happens is, in this case, Hope for the Community is a social enterprise that was developed by an academic at Coventry University, fab guy. So he's in your patch, so to speak. And, basically, their vision, for the future is, where parents, families and people across all communities are equipped and supported to manage their own physical and mental health, as well as be able to support others using self-management techniques. It sounds a bit wordy. I'm sure there's a simplified way, but sometimes it is a bit clunky when you're first trying to describe and explain what you do. And this was sort of the first attempt at Hope trying to get down, what is it that we're doing here? So they set out the vision is like a world where, or, we're making the world a better place in these ways. The mission, is usually short, sharp, and succinct. It's almost like your strapline. Is to be the mission is to be the UK's leading self-management care provider. And then it's a case of how are we going to get there? Hang on, I'll jump to a different one. So the how we're going to get there, you start to break down into, what's the solution? What's the proposition? What are the services that you're going to deliver? And there's a list of them there. It's training, it's bespoke programs, it's peer support, blah, blah, blah. You'll have your own things that you do as well. Who are the people and partners that we need? Sometimes you don't know, but even if you start to have a go at who you think your partners might be, it brings you a little bit closer to trying to approach them. Some of them might be people you know, people on your doorstep. Some of them might be like these groups, autism societies and groups, and Some of them might be larger beasts, like the University of such a place, or NHS England, you know. So there's a local and regional and national kind of set of partners that you might need over time, you know. Then it's coming up with, so what results, you know, how do we know, how are we going to measure success? What do we know are the outcomes? And this is, again, once you know what this is the sort of figures you can put in your funding bid to say, if you fund us, this is going to be the results, you know. So they know that they're going to be measuring a certain number of people, you know, per year undertaking courses and programs, a certain number of trainers each year, you know, and people supported through their learning hub, so many activities and new groups started each year, so many self-care programs. So it's a case of working out what are the nuts and bolts, what's the direct results that are going to happen. And once you've got these down, what are you assuming is going to be the impact of this? And this tends to be a bit more touchy-feely. So this is like, you know, people are going to be living, you know, happier, healthier lives, more independently for longer. You're going to reduce medication usage of certain conditions, you know, for the conditions that they're working with. The aim, you know, really that's more of a result in a way, but it moves into impact a little bit, you know, that the less GP and hospital visits. So really that less GP and hospital visits might be a result if they think they can track that. If they can't, it might remain in kind of wider impact. But, you know, as a result of less GP and hospital visits, you know, there's, you know, more capacity in the NHS in theory. And then, you know, stronger communities that can provide effective support to one another and be empowered to manage their own needs, you know, the pinnacle, you know, of what they're trying to aim for. So that just gives you a feel for the kinds of language that you might start to think about, how you're describing what you're doing and your impact in certain terms, so that you've pinned down what you think you're doing. You can start to communicate that with other people, and then you can start to review this in, you know, months and years to come. Are we really doing this? How many people did we get? How many trainers did we work with? How many activities happened? Are people doing this now? And are these impacts that we imagined actually happening? Down the bottom, and down the bottom here, you know, there's a set of like strategic objectives to achieve this vision. So I won't prattle into those. I think we probably need a separate session on some of that. And there's a, you know, and we do this because, so once you've started to kind of map your own theory of change perhaps in a version like this, or another one I'm going to show you in a minute, not only do you feel a lot clearer about some of the building blocks of what you're trying to do, and not only, you know, are you able to start to communicate that with others, you can start to report back on it, basically. So putting this kind of information together is good for lots of reasons. It's good for being clear yourself. You've almost got your elevator pitch on one sheet here, you know, and so you start to have a spiel, you know, whether you're on the phone, in a lift, in a funding bid, at an event, you start to simplify and cut out the waffle so that you can quickly get this information across to who you're trying to talk to. So I would definitely recommend as homework giving this blank sheet a go. And you might not fill every box. I remember doing this the first time, and it's quite easy to say what your vision, how will the world look better, you know, because your organisation's in it. It's quite easy to put down what you think your services are and who you think your partners might be, and then you start to get a bit stuck. You know, you might know why you do it, and then you might need to come back to someone like me or Arfan or whoever to kind of work around the gaps. But that's fine. Just getting the first bit down, and you might need someone to coax out of you or help you work out how you're going to work out the rest. That makes sense. So that's one example of a theory of change. There is another one in the pack. Sorry, and it does give you an example, so it will make sense to you when you look at it. It just shows you it in a slightly different layout. I'm not going to go through that because we've not got loads of time, but these things, it will be helpful for you to produce your own version of this, like I say. And again, this one looks very much more at sort of activities, outputs, short-term, medium-term and long-term outcomes. So whereas in this first version, it's kind of all lumped together, it's just a brain dump, if you will, of what you think you're doing and how often and what you think the results will be. This one starts to help you kind of peel it out a little bit more, and it also gives you time to think about, you know, what are some key assumptions and what are areas for development. So I give you a couple of tools there, because I always find what works for one might not work for another, so you've got a couple of options. Just in a nutshell, because we just started to talk about this, and I either want to give you the webinar or come back and do another one. It'd be just lovely to hear for a second whether, certainly Ebony might have started doing this, and I wonder whether Safina and Zabina have started to think, have you thought about how social value or impact is being captured in your organisations at the minute? Anybody want to give an example or talk about what they've started to do? I know Ebony's been...
I'm aware of social value, Michaela, but in terms of actually capturing it, because we've not had a chance to deliver much yet. So it is on the back of my mind. I'm aware of obviously the importance of it, but not actually done anything like
that's fine,
action-wise around it.
For sure. And I know Ebony, she might be busy with bits and bobs there, but certainly having got 60 clients now and having run several events, and numerous people have had her handbook and things now. So there's stuff to test and there's stuff to find out about. So it's like, how do you do that and in what order? So I'm just quickly going to share this. I'll try and be done by 1:15 and we will bail out. I just wanted to put it all into perspective. So some of that language that we've seen in other, the theory of change there, the theory of change helps you work out, you know, what are the inputs and activities that you're doing, and and then as a result, what's changed, you know, in terms of outputs and outcomes. That's the blue line here, the blue boxes, are kind of take you as far as your theory of change will enable you to get. But then beyond that, you're then looking, you know, as a result of doing all this, so what? You know, what is the impact? And then ultimately, what is the value of that, both financially, socially, environmentally, you know, in terms of happiness and well-being or whatever. So I was kind of showing you how the two things sit together. Your theory of change takes you so far, and then working out the social value of what you're doing gets you that bit further. And just to make sense of it, and you can read this at your leisure, hopefully this is fairly digestible, and it gives you a tool to go away and use yourself. So just to make sense of what the hell these words mean, an output, so if we could put this into an example. So let's say there's a course going on, you know, it's quite easy to imagine. So a woman called Jenny has attended a confidence building course. That's an output. And Jenny turned up, you know, as a number tick, you know, 30 people on a course are an output. But what was the outcome of that? So what? So the next thing along, you know, Jenny's improved her confidence. You know, she might have improved her confidence. She might have improved her knowledge. She might have improved skills. She might have, you know, there's different things that have happened as a result of Jenny turning up for that course. And that's the outcome of the course. The impact of that is like, so what? So she's improved her confidence, then what? What's happened since? So that might have led, in this case, you know, the pinnacle, Jenny has secured a job. So there might be various other things. Jenny might have secured a job. Jenny might have gone on to a training program. Jenny might have made a really good friend and is just feeling really, you know, so much happier about herself and less isolated. There's lots of impacts that can happen as a result of a course like that. And so then you start to move into, and who is that of value to? We'll move forward. Who is this of value to? And I talked before about these beneficial, or these, you know, who direct beneficiaries, indirect and wider. So we'll explain that in a minute, but hopefully when you look at this tool, you'll be able to sit and think about what's happening in your world, you know, or what might happen. So, you know, we're putting on a course, or we're putting on training, or we're putting on events, or we're doing one-to-one coaching with people, or group coaching with people, whatever it is. And you can start to walk through a similar scenario with what somebody experiences, what the outcomes and impact of that are likely to be. And then we can help think about, so what's the value here? And when you think about value, there's different kinds of value, you know, so direct value of this, you know, Jenny has now got more self-worth. She's got more money available because she's got this job, and she's going to start to pay off her debts, and she, you know, she can afford to feed a family and stop using a food bank, let's say, or maybe she can afford to take them on a holiday for the first time in 10 years. I don't know, but those are the direct benefits to Jenny. The indirect benefits, you know, her family are benefiting from her increased health and well-being. This new employer is benefiting from Jenny's skills, and local shops are benefiting. The economy is benefiting because Jenny's got more money to spend there. And then wider, when we talked about these people that you may never meet, but they're benefiting, or they might be interested in the fact that you exist, you know, the government's benefiting because Jenny's not on welfare benefits anymore. The school that Jenny's children are going to are benefiting because the children are happier. Maybe they're getting better results. Maybe there's, you know, less, I don't know, you can make assumptions till cows come home, but the school benefits there. And then, as we said, the local economy is benefiting from that money being spent. Go for it, Ebony, what are you going to say?
I just wanted to ask, you know, when you're producing this report, what would you say is a sort of a decent amount of a case study to have? So you've done Jenny. I love the way you broke this down. Like,
yeah, because this isn't a report. This is just helping you piece together, I guess, to think through how this is doable for you. And it's certainly doable in case studies. I'll come to you and answer that question,
yeah,
like a couple of minutes.
okay,
Is that all right?
that's fine.
So what I'm thinking is that I'm hoping that after today, when, you know, and this isn't relevant for everybody right now, but it will become relevant in the next few months or the next year or so, you can use this tool to, I don't know who's cracking here, so there we go. Basically, you can use this tool. It's not too hard to re-jog your memory around and start jotting notes in the boxes to say what's happening and what's the impact and who might be having some value here. So clearly there's this direct value, you know, to clients, beneficiaries, staff. There's value to wider people, the family, the community, suppliers, local economy. And then there's this, you know, much wider sense of value to all sorts, you know, even wider suppliers, local economy, the public purse, GPs, hospital, you know, there's a list there. You can start to think, who's got a relevant benefit to gain and what might that benefit be? And then soon, and when you start to realize that and describe that, you can then start to check whether or not that's something they want. Is there a strategy that's mirroring what you're doing, or a set of recommendations or a tender or whatever that you can then look at and say, we can do this. I'm really going to try and wrap up with, I promise. I'll come back, you know, I won't bore you. There are various methods of doing these sorts of things. And I'm only flagging this up because you might hear terms like social return on investment is a very long-winded, lengthy way of putting a financial value on stuff. It can be done in small bite-sized chunks where you can nick other people's what they call financial proxies. If somebody wants to do this in more depth, I can talk to them about that again. There's a saving to the kind of public purse. This LM3 is more of a locality. Again, it's money, but it's the localized money. So SROI is looking more at national and public sector money. This LM3 method is looking more at how are you saving the, you know, or putting more money into the local economy. And often that's your purchasing power or the numbers of people that are now in employment or have increased their income levels and that sort of thing. The one that most people can use and start using most quickly is this outcome stars method, where people have like a point score jump from like 0 to 5. If you've ever seen outcome stars, I can show you those, but they're very easy and accessible way to track and benchmark how people are experiencing your services, whether it's on a scale of 1 to 5 or 1 to 10 in a survey, or whether it's people drawing out on this circular thing where you mark off how you're feeling on certain indices that you choose. There's something called oh god, what's it called? Begins with a W. OneWebs. I want to say OneWebs. Is that right? OneWebs. Basically a mental health recognized indicator of impact and value, and I can share that with people who want to see that. But it's lots of charities, social enterprises, services, the public sector, the NHS, they have this WebWebs check that they do with people to see how they've improved in certain health and well-being indicators, and hacked and other, so that's housing. Certain sectors have developed their own sort of methods for coming up with ways of calculating this stuff. When you get these slides, there's some examples here to kind of read through and try and make sense of this. So I'm not going to read through all of this, but I've given you 4 little examples of different social enterprises and how they're set up, who their direct customers are, so what their products and services are, and who their direct beneficiaries are and indirect beneficiaries. And it seems like, oh, but actually it just helps you work out who's who, and it helps demonstrate that sometimes the direct beneficiaries aren't always the customers. So in some cases they are, but in other cases they aren't. You know, people in war-torn countries aren't going to be able to afford to pay for like high quality creative entrepreneurship skills training. So people like the University of Manchester, the Arts Council, Sainsbury's and the British Council are the customers in that case, and they're buying a whole range of outcomes that get delivered in order for the people to actually benefit from what's going on. Does that make sense? And I can run a session on this again, and I've got a pre-recorded thing, but I'm just flagging up how different organisations are using sort of social value measurement techniques to kind of filter out who's who and who might be benefiting. Because when you map out who the stakeholders are, you can then work out who you're going to ask what questions. It's quite hard to thoroughly survey who's got a vested interest in what you're doing if you haven't worked out who those people are yet. So, you know, in Deborah's case, you know, she'll have the children themselves that are doing certain kinds of homeschooling learning. She'll have the families of, there'll be other teachers and educational sort of professionals who are benefiting as a result. There'll be, I don't know, I'm not suggesting this, I'm just speaking out loud. There might be pupil referral units or PRUs, or the police, or libraries and museums, you know, wider places where who are benefiting as a result of what Deb's doing there. And so as part of designing a way to engage with who her stakeholders might be and find out what they value about what she's doing, at least if you've mapped out who they are, you can work out if you've got the time and the budget to talk to them. So just quickly, because Ebony was asking about putting this stuff together, through a longer conversation the other day, we can work out, who are these people and how are you going to engage with them to measure your impact and value. And so in this slide, we're saying who might the people be that we would want to engage with if we were trying to understand our social value. We know what people are engaging with. We know who these people are, and we've worked out on the different sides of the spectrum, the direct, the indirect, and the wider people, who's got something to say about what we do, whether or not they value what we do. And what I would always say in any social value stuff, not only are you trying to work out the so what's the impact, what's the value, how have people's lives changed as a result of what you're doing, it's a win-win, because at the same time as asking them that, you're also asking them for sort of market intelligence and market research and feedback on ways to improve things as well. So usually I would do both things at the same time. I'm not going to walk through, I am going to walk through this case study. It's super quick. So when you're trying to work out what to do and what to say and how to bother, initially you will just get a few testimonials, write the odd case study, tick off how many people turn up at an event consistently. You might ask them 5 to 6 questions. You might get them to tick a few boxes of whether they've got a smiley face or a sad face. Whatever the method is that works best with your group, you might get them to fill in a survey monkey. You might get them to create, a 2-minute video that they send you at the end of the course or once a quarter or whatever. This is all content that you can then analyze and figure stuff out with. So just quick, I said we were going to finish. In this Down syndrome case, you'll be able to read through it yourself. But basically, in the case of Down syndrome, there's direct people. So we know they've got people who've got a dance membership, people attending events. The wider business community are coming to workshops and away days around diversity and inclusion, and they've got staff, volunteers, and their board. So all these people directly coming into contact with this organisation have got something to say about it. Some of the methods that you might get in touch with them might be an application form in the first place, or an expression of interest, or whatever point of initial contact you make with them. There's a good chance that you can start your social value research journey with them from the outset. And you're just asking a few key questions about who they are and where they're at, or their starting point in their learning, development, or access to stuff at the point of contact with you, so that you can then show the difference that you made further down the line. So people forget to do that. So right at the beginning, you can tuck stuff in. There might be one-to-one notes and reports, surveys, like I say, videos, focus groups, you know, other events and social events and celebration events where you're actually squeezing in creative activities that are actually all part of evaluation work. So that's an example there. The indirect, or these other people, you might not get hold of them so readily. So interviews, surveys, focus groups, and different kinds of evaluations might be a way to get hold of them. And the wider, again, you might get hold of them if you can find them, you know them, they're around and about. Or it might be that you're going back to that market intelligence that already exists, strategic reports, annual reports, and so on. So it's just showing you the layers of people who have something to say about what you do, how you might engage them. But the bottom line is, on all of this, it's not complicated, because there's only a few questions you've got to ask. Yeah. All that you're really asking these people at an interview, through a one-to-one, in a group, or whatever, you want, what have people got involved with in your organisation? What has been of most value, and what have they enjoyed most? What are they doing differently now as a result? You know, and how have things changed or improved for them? Initially, that's all you're really asking, and that gives you so much insight into what they think. It's quite mind-blowing, because you will assume lots of stuff, and lots of your assumptions would be correct, but actually what they tell you, and whether it's heartwarming tales, and I could give you millions of them, but we haven't got time, whether it's heartwarming tales of stuff and those testimonials and case studies, or whether it's knowing that you've talked to 20, 30, 50 people now, and these patterns and these trends and these same phrases and these same comments are coming out each time, then gives you the ability to build your own statistics, or helps you build in new questions that you can track consistently. So I can talk to you again about that, but it's just starting to show you how it isn't actually that hard to start to do this. You know, some of these elements you will already be doing, and it's just a case of making a start with it usually. What have we here? Yeah, no, that's a tool for you to go away and come up with your own plan. Who are your direct customers and beneficiaries? Who are the indirect? Who are the wider? And thinking about, have you got the time, the capacity, or the wherewithal to want to do this? What have you got? What could you start? What might you need support with? That sort of thing. There's a little slide. It's almost like a sales pitch for us, but it's not really, where it's just showing you what it looks like when it's done well. You know, how you know, who you're going to map and who you're going to focus on. The kinds of techniques that we've just talked about, how you're going to reach them. And then it's how you analyze the community, the stuff that's there. And then what I'm saying is, in lilac, in the lighter purple color, you know, you are all smart people. You can do most of this. You might not have time, so you might need to buy people in to help you, or you might, if you're going to task an intern or a researcher, they might come and help you. But basically, this independent consultancy, but at the time when you need some of this other stuff, you might need training, you might need to facilitate groups because you've not done it before, or you need help, or you want it to be independent and legitimate and done separately from yourselves, or you're wanting that specialist sort of cost benefit analysis work doing that costs out what's saving the public purse here. That's the point where you can bring people in. But I'm just trying to hopefully show you that you can start this stuff through some of this activity, and through then starting to work out the best way to analyze it. Ebony, I'll probably come back separately, as in how long should these things be? You know, who knows? What I've got as my last sheet here, and I can send you examples of this. I've done a few of these. There's some very thorough and very robust social value reports, and you know, they can cost £10,000 to £30,000 to get them done well. And then there's more of a kind of 4 to 6 page fag packet, quick and dirty, version where it's more like, you know, £1,200 to get something done and everything in between. So that's what independent people would be doing. You yourself can start to look at piecing together, you know, you'll see here, you know, there's bits of case studies, coming up with the basics and coming up with certain things and certain stats you can do yourself. But I would say when you want to start quantifying it into numbers or how much you're saving the public purse, or when you're wanting to, I haven't really talked much about, develop your own key value indicators. The whole point of doing this is so that you can eventually develop your own sort of metrics, so you understand where is the value that you're creating, where are we creating value consistently, and then you build your evaluation and impact questions around that. So you're not trying to be all things to all people, and you're not evaluating a million things when actually your main stakeholders value these 4 or 5 things. So that's what you should be focusing on. So I know we've gone over time, and I know we've probably not gone as thoroughly into social value measurement as I would have liked, but is everyone asleep and thought, oh, thank God it's the end? I'm just wondering whether anyone's got any. It's a lot to pack in on a Saturday. And
just to say thank you very much. I love this session. This was a very good session, even though my internet wasn't brilliant. So thank you very much, and thank you all for attending as well. It's good to see you.
Yeah, and like I say, what I'm going to do after today, I'm going to share the PowerPoint. I'm going to share the worksheet thing again. I'm going to share the 3 bids that I showed you. And then I'm going to share a couple of links to big, juicy social value reports. So people that want to see what have people done when they've really thrown everything at this, or as much as they can at this, and what did it produce for them. And certainly people who I've worked with, like there's Horseherd, there's Levenshulme Market, there's Ready Lane Market Garden. There's a number of people we've done work with. PI, Pursuit of Individual Excellence, which is like an ex-teacher that's then set up an educational organisation. They found that it has worked. It has won them bids, it's won them awards, and it's given them some clarity on what they're doing. And it's very cathartic when you can find the time to do this. You learn when you put a bit of a plan in place to go, right, we're doing this social value reporting work now, and it's starting here, and we're going to try and finish it here. You learn an awful lot, and it really helps you refine your products and services, and spot new service development opportunities, because when you engage with your stakeholders, they just tell you it like it is, and it's very clear to see what you should be creating and delivering. Anyway, I've stopped talking because I've talked all afternoon there. So more than happy to keep chatting individually about all of this to kind of make it make sense at your stage of development, and look forward to seeing you all soon. I'm just gonna